So some of the most important parts of the survey was the themes that people wrote. And there were pages and pages and pages of things that people were able to add comments to. And so I just wanted to, I took that document and I kind of pieced it apart and tried to come up with like 10 common themes of what people talked about. And the first one was that we want to be recognized for the work that we do. And I think that probably everybody in the room agrees with that. Another common theme was the term mid-level. It can be offensive and doesn't reflect the professional role. I was surprised myself actually at how many people did not like that term. So hopefully one of the goals of this council will be to figure out what to call ourselves. Another thing is we want to be utilized to the fullest capacity that we can, that our license and certifications allow us to have. We want professional networking with our peers. Many people talked about how valuable that would be. And Ann talked a lot about how we're all very smart in our own specialty areas, but it would be nice to have some role development and some professional development in regards to from an institutional level as well. We would like to have an infrastructure developed for our group, similar to what nursing does and medicine has, but more specific to the PA, ARNP, and what some of the comments that were in relationship to this include, just a channel to go to when we need stuff or when we have questions about our practices or our licenses or anything really, orientation, any of those things. We don't have an infrastructure in place. When we hire a nurse practitioner, it depends on who's paying us, which category we fall in, whether it's medicine or whether it's nursing. And it would be nice if we had a separate place where, some place that housed us as a group. Another common theme was UIHC investment to educate patients about the roles that we play and how we benefit them. One of the things that our particular group in the Women and Children's Services in the NICU, we have patient satisfaction from the Press Ganey reports, but nowhere on there does it ask about nurse practitioners or PAs, and so we would like to see some reflection about us in the patient satisfaction surveys that go out. Maybe your other areas have that, I don't know, and if that's the case, then it's good because then we can network together to come up with ideas that would apply to all areas. Another common theme, visibility through marketing and communication venues such as websites, directories, commercials. A lot of times we're listed under insurance companies as providers, and I don't know about many of you, but I frequently will get calls from patients that move into this area that want to know if I can see their patients or if I can see their children or their families. And so just having an avenue to kind of send those kind of calls. I'm a pediatric nurse practitioner and a neonatal nurse practitioner. I practice as an NNP, but I'm probably listed as a PNP. We don't have a primary care pediatric nurse practitioner service here at the university, but maybe that's something that we could look into. Those are just ideas in regards to some of that marketing. Other things, I have this vision, and my staff probably are going to laugh, but I always think that, when you get off at exit 242 and you're driving down the road, you should see a big billboard with all of the nurse practitioners' faces, because we're the ones that take care of the newborns in newborn nursery. Not alone, of course, with other people, but just that kind of marketing, have our faces out there to be the faces of the university that are taking care of the patients here. More involvement and voice in some of the UIHC committees, more professional development, time, ability for research, publications. I'm amazed at some of the things when I see a nurse practitioner name, I sit on the PA ARNP committee, and just, for fun, sometimes I'll Google whoever it is that is going to get credentialed, and they are amazing. They have a lot of publications, they have a lot of stuff that they have developed, and just, advertising that and marketing some of that, or even giving them time, 5% of their time, or 1% of their time, or 10% that they can actually expand on that kind of stuff would be really nice. We are the group that takes care of the patients, we're the front line. So again, those are just some ideas that was pulled out from the themes. And then the last thing was the development of the ARNP PA Council. You know, people liked this idea, and I hope that we can, you know, there's 208 of us, and, you know, I don't know, there's probably 40 or 50 of us here. Hopefully we can go out and talk to our colleagues and encourage participation so that we can get, you know, it's going to take all of us. So as far as just some of the other highlights for this talk, and I know that we're on a time crunch, everybody's busy, but we do have over 200 NPs and PAs employed here in this organization, and we are virtually in every service here at the hospital. We are inpatient, we are outpatient, we have subspecialty care services. So, you know, Ann made a good point that even though the CRNAs and pediatrics probably hire the majority of nurse practitioners and PAs, they're all over the place, and you know, the one or two that are in each one of the departments probably feel rather isolated. But when you put us together in a group, we're a big, we are a big group of people. So she also talked about some of the benchmarking and some of the webinars that are out there, and when you look at some of those, they have amazing data and great ideas that we need, that, you know, probably many of us in pockets do here at the university, that would help us, you know, kind of guide the light for structuring ourselves. I pulled out some highlights from this particular project. It was called the Mid-Level Provider Benchmarking Project Findings. There were 25 organizations that were involved in this particular study. We were not one of them, but it was a webinar presentation by Kathy Krisek, and the focus behind studying this group of people, the ARNPs and PAs, were based on four things, and the first one being complex billing and reimbursement issues, increase in utilization of this group of people, ARNP meaning us, you know, PAs due to resident work hour restrictions, difficulty in monitoring or quantifying outcomes based on our care, and the need for cost-benefit data.